We live in a world where most of the threats that are coming at us are psychological in nature. Am I going to be losing my job? Did I get that promotion or did I not? Can I afford to pay my next bill? The MRI results came back and said, what? And yet, in response to those psychological threats, we have a physical reaction. That's what our brains are good at. We're still the bear in the woods, fight, flight, hide. And so we get this dump of adrenaline, we get this dump of cortisol, all of which triggers us to go to a place where we're not as able to process complex thoughts. We move from conceptual processing to perceptual processing. Or, put a better way, when we start having threats come at us, oh my gosh, we're starting to ramp up. I'm not sure I can handle this. Blowfish. Blowfish is our response to the threats. Blowfish isn't listening. Blowfish is paying attention to threats that I can hear, threats that I can feel, threats that I can see, maybe even smell. But Blowfish is not paying attention to any kind of complex thinking. And if we're dealing with somebody who's in a high stress mental space, including ourselves, until we deflate the Blowfish, nothing's going to sink in effectively. We've got a client who's in Blowfish mode. We have a client who is escalated in an emotional sense of the word and is having trouble hearing our messages. This is the person who ultimately walked into their oncologist's office and says later on, I heard the words, you have cancer, and then the rest was like a Charlie Brown special. Or the person who walked in and said, I heard my diagnosis, and then I didn't hear anything, but I remembered the way that the hallway smelled, and I remember the art on the doctor's office. That is perceptual processing instead of conceptual processing. There's a difference between empathy and compassion. The Cambridge Dictionary difference is that empathy is when we put ourselves in someone else's shoes. We try to take on their perspective in order to create a stronger connection, a better sense of understanding, and hopefully be able to support that person in a better way. Compassion, on the other hand, is we see suffering and we have a strong desire to relieve that suffering. Pretend you are standing on a dock and you see someone on the water and you realize, oh my gosh, they're in trouble. They're drowning. If I were in their situation, what would I want? I want you to come and get me. So you jump in the water and you go get the person. And that is empathy. But now you're in the water, you're in the experience, you're in the emotions with the person. And any lifeguard worth their salt will tell you that's a dangerous place to be. You don't have a lot of control, you don't have a lot of options when you're in the water. And if you were to jump in repeatedly, over and over, multiple times in a day, multiple times in a week, it's exhausting. Now let's go back to the dock. You see someone in the water, they're in trouble. You recognize, oh my gosh, they're drowning. You intentionally take a little half step back. Okay, do I understand the nature of the problem? Yep, pretty clear. Okay, what skills or knowledge do I possess that can make this situation better? And so you reach to the side and you grab a life preserver and you throw that to the person while simultaneously yelling for help. This is compassion. Compassion operates different than empathy in this scenario because compassion is focused on action, on doing instead of feeling, on doing for rather than feeling with. And compassion ultimately is a place of agency. It's a place where, because we are action-oriented in our thinking, we can protect ourselves a little bit emotionally, and we can feel like we accomplished something, even if the situation around us is going poorly. Add to that, we're better able to think clearly that if the first solution doesn't work, we can create another solution. So ultimately, we're helping to keep a safer space for the person who's in distress. So the way that we deflate Blowfish using compassion is we use a lot of reflection and a lot of open-ended questions. Instead of trying to put ourselves in the other person's shoes and imagine what their threat is, we ask enough questions and we reflect enough of what they're telling us that we, quite honestly, cognitively dig out what that person's threat is. So I take their Blowfish self, and if this person's, and I might ask them, what are you most worried about right now? Or I might just observe, you look pretty surprised, pretty shocked by this news. What are you feeling right now? And as that person can call out the emotions that they're feeling, our reflection of those feelings, our reflection of where that person sits, is on its own accord going to contribute to deflating. Because if we recognize what's happening, then we're identifying the threat. And if we continue to be calm in the face of that, okay, yeah, I see that this is where you're at. Okay, they've recognized that I'm in a threat space. They know what it is that's scaring me, but they're not panicking. I see that you're feeling stressed. I see that you're feeling frustrated. That gives that person a chance to correct us. That's not what I'm feeling right now. And often that's where empathy, I find, gets it wrong. When I put myself in your shoes, I get me in your shoes. Me in probably a pretty uncomfortable pair of shoes. I bring my values and my experiences to you. And so in all likelihood, in complex situations, I'm going to guess wrong. It might be that what you're thinking is not, oh my gosh, how am I going to tolerate the side effects of these treatments? How am I going to navigate this? It might be that what you're thinking is, if I have to do surgery as a result of this diagnosis, I'm going to lose my job. It might not be the disease that's the threat for you. It might be the loss of your job. And until I understand what your threat is specifically, I'm never going to be able to effectively deflate you enough to hear the messages and the education that I have to give you.